Hi, my name's Cheyenne, and today I'm going to be recording my anatomical terminology assignment. I'm here with my sister Kiera. Kiera, do I have permission to record you today?
Yeah.
Okay, so first we're going to start with the anterior. This is going to be from the side view. Anterior is towards the front of the body or in front of, so the ribs are anterior to the spine. Next we have the posterior. This is also going to be from the side view. Posterior is towards the back of the body or behind. So the occipital bone is posterior to the frontal bone. Next we have lateral. We're going to show this from the front view. We're going to demonstrate with a piece of paper as well. So lateral is away from the midline. So the midline is basically when you cut yourself in half, moving away from the midline. The lungs are lateral to the heart. Next we have the medial. This is also going to be from the front view. This is our midline. So medial is moving towards the midline. So the trachea is medial to the clavicles. Next we have the proximal. Proximal is going to be shown from the front view. Proximal means close to, so the scapula is proximal to the humerus. Next we have distal. This is going to be shown from the front view. Distal means far from. So, for example, the wrist is distal to the elbow. Next we have superficial or external. This is meaning towards the body surface. So if I was to cut Kiera in half, the example that I have is the epidermis is superficial to the dermis. Next we have deep or internal. This is going to be away from the body. So the hypodermis is deep to the dermis. Next we have the sagittal plane. We're going to demonstrate with paper again. So the sagittal plane cuts the body into right and left parts at the midline. So here is your midline. Here is your right and left parts. Next we have the transverse plane, which cuts the body in half. Going to demonstrate with a piece of paper. So here is the transverse plane. Here is the sagittal plane. Next we have, can you hold these? Next we have the coronal plane, which we're going to turn sideways for this for a second. So the coronal plane cuts the body into front and back sections. So you have your front and back. So if we have her facing forward again, the coronal plane would be like this.